The budget cuts proposed by the governor and the legislature have been pretty predictable, but one cost-saving measure undertaken by the Assembly Democrats has some people shaking their heads. I'm referring to the Assembly's proposal to cut $52 million from the state's smoking cessation program, which is actually considered to be quite successful and an ongoing campaign that has helped people to kick the habit. That will all but decimate the almost $60 million program and, according to anti-tobacco advocates, drive up health care costs in the long run. Joining me now to talk about this is Russ Chandra. He's the Director of Advocacy for the American Cancer Society of New York. And then across the table we have Dr. Richard Rubin. He is a board member of the American Heart Association. Thanks very much for being here, both of you.
Thank you.
So were you indeed surprised? I was surprised when this happened.
Well, we were a little bit surprised that it happened publicly, but actually we knew that last year in the budget renegotiations that went on, the Assembly had sort of led the charge in cutting this program.
But why?
Well, that's a good question. You would have to ask the Assembly.
Okay.
I mean, you know, one obvious question is what interest is going to be happy if people don't quit smoking?
Big tobacco?
I just see it as an easy target, you know, just money that can be carved with probably little notice. I mean, the wisdom of doing this is unsound on two grounds. I mean, it's unsound from a public health ground, given the amount of progress we've made in stopping smoking, particularly among young people and other groups, and it's unsound on a fiscal basis, which is the point that I really, you know, I'm a physician, but on a fiscal basis, there is such return on every dollar.
But the reason why it doesn't make sense to me is I was under the impression, and you should definitely correct me if I'm wrong, that people who start smoking, it's a habit that the wealthier you are, the more you know generally about it in terms of stopping. So the Assembly Democrats have a history of being sort of champions for low-income New Yorkers and human services, and that's why I found this a surprising thing, even if last year, I dimly recall that there was a battle over this. But am I wrong about that?
No, you're absolutely right. And I mean, poorer people smoke more. And the reason they smoke is because previously they have not had access to the same kind of services that, you know, middle-class people have. They all want to quit. It's just getting the services. And what has happened since we put this program in is we've seen a really significant decline in smoking among the poor. They still smoke more than, you know, the general population, but smoking among Medicaid clients, for instance, is down by 1/3. And as Dr. Rubin said, that kind of thing translates directly into saving money for the taxpayers.
I'm told that the Tobacco Quit Line, which is one of the programs that would be cut under this, received 160,000 calls last year. In the time of a short office visit with a patient, you can't really counsel them. You can give them a toll-free number. The state will provide them with free nicotine replacement, counseling. You can't overestimate the value of programs like that.
Well, what you're arguing is, I mean, some people might say, well, why should the state be in the business? I mean, if you're a pure libertarian, you might say, it's really not the state's business what you do with your own body. It's not the state's business to tell you what you put in it, and it's not the state, or tattoo on it, or whatever you do. And so why should the state be in the business of telling people how to conduct their lives, even if it's harmful for them to do something?
We could be in a very long argument and discussion about that.
Indeed, we could.
Clearly there is a public health aspect to this and a huge cost.
Well, and and it's the cost. The other thing is that, you know, those same libertarians expect and have a reasonable expectation that they're going to get their medical treatment taken care of when they get sick, and we all pay for that. I mean, whether their treatment is paid for through government-paid programs or even if they're on private insurance, it raises everybody's premium.
But you have a figure, $980 million in health care costs, of which $273 million will be paid by Medicaid. Where does that come from, that figure, those figures?
That's what it will cost if they zero out this program, that it'll increase Medicaid costs by $273 million.
Because we expect that people will get sick in the long term?
Because more people will get sick in the short term, and in the long term, really sick.
Secondhand smoke. I mean, the dangers of secondhand smoke. All of the progress we've made will essentially be lost in a generation by cessation of the efforts.
Okay, so the question now it becomes, I mean, are you making any progress in trying to restore this fund, this money back into the budget? I
was over at the Assembly today. There are a lot of Assembly members who, as you know, they don't know what's in the budget when it's presented.
Right.
When they found out, they got very upset about this. There's a lot of noise about it. You know, so I think perhaps the leadership is feeling a little heat from the back. But the fact is, I think it's up to the governor to, stand up for the budget that he submitted and to defend this program and to not make a deal.
No, he did not increase funding, the governor,
No.
but he did maintain the same level of funding that had been in previous budgets. I mean, also in terms of kids, when you talk about more kids will start smoking, I mean, are young people really accessing these kind of programs, these quit smoking
sure.
programs?
They are, absolutely.
They are.
Well, it's more than just quit programs. There's youth-based programs. There's educational programs that go on. It's not just a media program. It's not just a smoking cessation program. It's a comprehensive smoking control program. Youth and adults, active smoking, secondhand smoke, all of that. And it's the synergy among the different elements that really have made the program so successful. Smoking rates in New York are going down faster than the rest of the country. And the reason is this program.
Dr. Rubin, I'm sorry?
Seton Health is very active with the Smoke Cessation Center, and we are in the schools. We are presenting programs, targeted programs to all age groups. So we are definitely making progress, and I think the message is getting through to young people about the long-term health benefits if the message is presented correctly.
Well, I mean, if all of this is the case, then why are we not actually expanding the funding for this particular program?
That's a very good question.
I'm just questioning that.
Given the
I mean,
fiscal benefit and everything else, I would
in a
ask the same
perfect
question.
world, what would you want for this program? What kind of funding would you ask
Well,
for?
the Centers for Disease Control says that New York should spend about $200 million a year on its program.
But
I really
the
don't think
tobacco
so.
settlement cover some of this?
Well, you could pay for it out of the tobacco settlement, but the money from the tobacco settlement is not earmarked for any particular purpose.
Right, right.
But in theory, this program is paid for out of the old HICRA pool, which was started with tobacco settlement money.
Right. I mean, and 200 million as opposed to 58 and change is actually a pretty big, pretty significant difference there.
Yeah. But we were doing good with 58 million.
Yeah, but we'll go back to the 80. I mean, we'll take it.
They've cut the program 30% in 2 years.